Hey everyone, welcome. This is Jason Clemmons, Doctor of Chiropractic at the Rock Health and Wellness Center. And this is Life with Jason Clemmons, DC. We are live, I think, right here in the Rock Health and Wellness Center studios. I'm live. The radio's live. Let's see if social media is live. I think we are. I hope you guys had a great week. If we're live, we're going. Here, hang on real quick. Yep, we're live. Perfect. We hit all the buttons right. We just didn't know it. Sometimes you just don't know that you don't know. That's a fact. Hey, it's great. We're great. We're live on 98.7 Walk by Faith Radio, 1420 AM Lubbock Christian Nation. We're on social media. Got a question yesterday on social media. Where do you have all of these videos archived? We have them at the Rock Health and Wellness Center. In Facebook, we have them at Health from the Rock on YouTube, and we have them at Jason Clemmons DC on X. So they should all be there. I went back, and some of them last year or back in 23 when we started this thing that were really where the audio video stuff was really bad. I deleted some of those, and we've kind of worked through some of them, but mostly the last 6 months or so. They're good, so you can go back and catch them. If you need the information, you can go back and get that information on those. I've tried to label them a little bit better on Facebook as we've gotten through here. So, yeah, we've had a good week of conversations. We had a really good show last night. I think got some good feedback about it. We talked a little bit about depression and the nervous system as it relates to depression. And how important it is. And we started off talking about food, and we ended up talking about depression. And so if you missed that show, it's got a lot of information in it last night, which I think was really cool. Enjoyed it. And then the Monday and Tuesday shows were really good. With the Taking Health to Church stuff, there's some really good fundamentals and some good philosophy in there if you're interested in that too. And so. But yesterday, what we said is that there were two things I wanted to talk about yesterday, and we talked about one. We talked about the conversation that I had about the person asking me about their goals, and when it came to food, and I thought that was very important, and I thought it was very important because I think it's very important to understand what you're trying to accomplish with your food. And so that's what that was about last night. But the second conversation that I didn't get into last night is what I want to do tonight. And I want to talk about the importance of afferent input into that's the input into your brain. And I want to talk about the side effects of not getting that properly, and then what will end up happening in some of the things that you might go search for. And so that's what we're going to do tonight. We're going to talk about that. And so we talked, but what we kind of went at the end of the year last year in 24, if you want to go back and look at some of those, we did some fundamental things. We just talked about some basic stuff there in December and one of them was about afferent and efferent input. And so I don't want to rehash that whole thing, but I do want to explain and see if I can do a better job of maybe showing you why that's so important, and then it'll back into what it'll back into movement and diet and inflammation and all those other things that we always talk about, right? And it's like we can get as complicated as you guys want to get when we're talking about all this stuff, or we can really we can get a big picture. And I think the biggest thing we try to do on this show is get a big picture of what's happening. So brain, just input, just touch something, touch anything. I'll touch these old cans of Dr. Pepper and Sprite I got here. That this stuff that some people drink. All right, so I'll just touch a can. I could feel it. I could feel how smooth that can is. I could feel it's cold. Actually, it's got a little bit of coolness to it. I could feel that right there. And then I take my hand off of that, and I could feel the top of this Hacking of the American Mind book that I got sitting here. And I could feel the cover on that, and it's really smooth. And then I can take my hand over, and I can look at my Master and His Emissary book that I've got. Now that's a different texture right there. That I can feel those two different things. That's texture that I can feel between the three of those, the can, the two different books. It's a different texture. Now I could touch the standard process bottle of Cataplex B core right here, right? Well, this is kind of a cardboard type feel to it. And it's like how do I know all that stuff? Right? How do I know the difference? If I don't even have to look down, I could just tell you those are made out of different materials by putting my hands on them, because I have in 1 square centimeter. You guys ever take a ruler and put it on the pad of your fingertip, and then just measure out 1 square centimeter? And if you do that, you can look at that 1 square centimeter, and you've got 2,500 receptors. You've got 2,500 receptors per square centimeter in your fingertips. Like, I have 2,500 different nerve supplying receptors in my fingertips. And where that information is going is it's going from my hand into my brain. It's going from the periphery, and it's moving into the brain. So it's going from the hand into the spinal cord, up and crossing, and it's actually moving over to the other side of the brain over here. Okay? I'm feeling that. If I touch it with my left hand, my right side of my brain is where I'm catching that information. Now it's going through the brain stem. It's got some pathways, and it's got all kinds of exchanges that are going there. But that information is going from the periphery, and it's moving into my brain. And that's called afferent. It doesn't matter what it's called. That's Hippocrates and those guys that named all that stuff thousands and thousands of years ago, whatever. It's like, that's just what it's called. And it's called afferent. It's moving from the body towards the brain. It's the information that goes from the body towards the brain. Now, my brain sends information back, and the information that's coming back down from the brain to the body is called efferent. All right. It doesn't matter, except we just need language to communicate with each other. That's the only reason it matters. The point I'm going to try to make tonight, if I can do a good job, is I'm going to try to express to you how important afferent information is into your brain. I've heard since chiropractic school that your brain receives 3 trillion bits of information per second. I don't know if that's a true statement or not. I don't know who came up with it. I don't remember where I heard it. I can't cite it for you. That's just what I've been told. I've read it in books or something somewhere along the way. It's been 23 years since I started chiropractic school, so I don't remember exactly where I heard everything, but I just know that that's one piece of information. Is it 3 trillion bits of information? Well, I don't even know what a bit of information is, to tell you the honest truth. I just know that's a lot. And it's a lot of information. It's a lot of information that's coming from your body, and it's going into your brain. Now, just think about that. If your brain had to process 3 trillion bits of information, your brain would be as big as this room. Like, we wouldn't be able to walk because our brain would be so big. We'd just have to sit down. Our head would just flop around all over the place because we wouldn't be able to handle all that information. So what our brain does is it does this word that people get lost with a little bit. It inhibits. It turns it off. It blocks it. It stops it. It's just like, no, I don't need to know that information. And a great example is right now you're not thinking about your shoes. Except for right now you're thinking about your shoes. Right? Like 5 seconds ago, you were not thinking about your shoes, and because you were listening to what I was saying, and you were trying to decide if this show was going to be good enough to stick around with and listen to, and you got probably getting ready for supper or trying to go eat or do whatever, and you're thinking about a lot of different things, but you're not thinking about your shoes. And then all of a sudden I say, you're not thinking about your shoes, and then what happened? You started thinking about your shoes. Now, let me ask you this. Did that piece of information all of a sudden get generated from your foot and go into your brain? No, it was already going into your brain, but your brain was inhibiting it. Your brain was like, okay, thank you for the information. I appreciate you telling me that I've got my shoes on, but it's not important for me right now to know. So the brain just basically dampens it. And it dampens it and because it dampens it, it gives us the opportunity to have a head that looks natural on our bodies, right? We don't have this gigantic head. But it's constant information from the body to the brain, and it is in a large number. 3 trillion, let's just go with it. 3 trillion bits of information per second. So your brain is receiving lots and lots and lots of information. Okay? It's receiving it from your liver. It's receiving it from your spleen. It's receiving it from your stomach. It's receiving it from, remember those neuropod cells that we were talking about yesterday? That we were talking about the neuropod cells that are in your stomach. Diego Borregas, I think he's at Duke, right? Look him up if you want to. Neuropod cells eat the sugar. Sugar goes into the intestine. The neuropod cell in the intestine detects that you have the sugar, sends the information to the brain to tell you that your brain that you received the sugar in your gut. Makes you happy, right? Feed the mice. Remember the whole water thing? Yes, that's an afferent input that's going from your gut into your brain. That's afferent information. Your ligaments, your tendons, your every joint, every muscle, your fascia is a sensory input organ. It's the largest sensory input. Your skin, all of that, all of those things combined, all come together, and they all are feeding your brain. And your brain is processing all of that information all the time. And it's supposed to. You ever gotten really still, like you're just sitting there, and then all of a sudden you just twitch? Yeah, you know what that is? That's a reflex that happens when your brain loses your body in space. It's like, hang on, don't do that. We can't just sit there and just not know where our body is. Your brain knows what's going on. Your brain knows where your body is in space, and if it loses it for a second, it'll shake it up, make you move. So your brain is receiving information, and it's vitally important to keep your brain healthy. So last night we talked about depression, and we talked about low amplitude into the right hemisphere. And I didn't get into all the details of that last night. I didn't get into the posterior aspect of the brain or the anterior aspect of the brain or whatever. I didn't get into all of that part of it. I try to keep it just global picture of how that works, a big picture. But we talked about, okay, one of the things you can do. Ken asked me early this week, Monday, on Inauguration Day, when I called into the Thin Line show, he said, what is the one thing that you would make a recommendation for someone if they were trying to get healthy? What's the very first thing they should do? And I said, start walking. I said, is there a bunch of things you could do? Yes. We could talk about all of them. But what is one thing that would be very advantageous to do? Start walking. And why did I say start walking? Get on your feet and walk. Why? Because of the afferent input into the brain. That's how important I think that is. That's how important I think firing the brain is, by getting on your feet and walking, right? So we talked about that last night. So exercise, movement, bending, squatting, turning. One of you that might be listening to the show, do not, you know who you are, do not be turning this weekend. We're not doing any quick pivots, so don't be doing that. Slow turns, right? But the rest of us, we want afferent information, and we want to move. We want to move these joints. When you move these joints are just firing your brain. Like it is just sending so much information, because my brain wants to know, is my finger straight or is my finger bent? It wants to know the difference, and it doesn't want to. It does not using my eyes, because I can close my eyes and tell you my finger's straight and my finger's bent. I don't need my eyes to know why, because I have receptors in the joint, and the receptors are feeding into my brain. Okay, and I'm going somewhere with this, so hang tight with me, because it's super important that we get that afferent information traveling into the brain. All right, we got to move. So what is happening right now in January 24th? It's cold. It's been cold all over America. What is happening? How many people do you know right now that are dealing with depression, anxiety, fussiness, like they can't function right, their back hurts, their joints hurt, they got all kinds of trouble going on? It's like, what is in what's happening to us? We're not moving. How come how come we feel so much better in July when we're all outside walking, and we go for a walk, and we get moving, right? So we need that information going into the brain. It's very important, okay? And that's afferent input. And one of the parts of your body that creates some of the highest levels of afferent input is your spinal cord and your joints. Not your spinal cord, your spine and your joints. Your spine is your whole spinal column, with each one of the joints in the spinal column is sending very large amounts of afferent input into your brain constantly. It's very, very important that your spine moves. And am I saying that because I'm a chiropractor? Yes. Am I trying to sell you on something? No. I very seldom sell anything. I tell you can get Standard Process if you go to the rock.standardprocess.com. That's about it, right? I'm not selling you. You're not having to pay any money to listen to this. I'm not even getting paid for this show. I'm just sharing this information with you, and I'm telling you that I've learned as a chiropractor and as a functional neurology-based chiropractor that your vertebrae and your spinal column is sending a large amounts of information into your brain. That's why it's very important to make sure that your spine is moving properly. It's vital. It's vital that your spine is going through proper ranges of motion. And you say, well, Jason, what do you mean by that? Because what are you talking about? What would be an example of a spine that's not moving through proper ranges of motion? Well, here's a picture right here. You guys on the radio, you can go to Walk by Faith Radio Facebook page and see this. You can catch it on ours. But I'm showing a picture of a normal cervical curve. This is an x-ray of a person from the side. And I'm showing what it's supposed to look like versus a degenerated cervical curve on the other side. And it's like, okay, when you look at the deteriorated one, what is one thing that's happening right here? The one on the right that has the degeneration, and what I'm saying is, if you start up at the top and you look at C2, there's a good gap between C2 and C3. There's no degeneration in that right there, that joint. You move down between C2, 3 and C4, there's no degeneration. Move down one more segment and you start to see the degeneration happen. Okay, move down another segment between 5 and 6, and now you've got maximum degeneration in this particular spine. This is where we're starting to see the bone spurring in the front. We're starting to see all of this nastiness looking stuff down here. And then we drop one segment below and look how much better it looks. Drop 2 segments below and look how much better it looks. That's my argument right there that has nothing to do with age, because every one of these discs was born on the same day, but this middle section is worn out. Okay, that's the degenerative part. That we're not talking about that right now. What we're talking about is this section of the spine, because it is a reversed cervical curve, this section of the spine is not moving properly. And when it's not moving properly, it is decreasing the afferent information into the brain. It's changing afferent input. You're not getting 3 trillion bits of information per second now. You're getting 2,900,000,000,000, whatever, something, or 800 billion. And you think, well, does that really matter? Yes. Yes, that matters. Because you'll end up with vertigo. You'll end up with a tremor. You'll end up with an inability to converge your eyes. You'll end up with midbrain syndromes. You'll have things, and you'll want solutions. You'll end up with anxiety and depression, and you'll end up with acid reflux disease, and you'll end up with digestive troubles, and you guys will end up with low testosterone, and you'll go searching for we got a new doctor in town that does men's health. You know what he advertises? Low T. Low T. Of course he does. It's low-hanging fruit. Don't want to talk about why there's low T. We just want to give you pellets in your hip because you have low testosterone. But we don't want to talk about your decreased afferent input. No, that would be too complicated. That's all right. We're going to talk about it. Okay? So this segment is not moving. It's causing it to wear out faster, and it's decreasing the information going to the brain. Okay? And I can show you x-ray after x-ray. Here's one with a plate in it. All right? Now we got one. We got screws and plates. Perfectly healthy, perfectly healthy, perfectly healthy, degenerative, disc bulge, get rid of that disc, whole thing. There's a screw and plate. Do you think that segment is moving properly? Absolutely not. It can't. This segment can't move at all because it's screwed together. Okay? Let's switch it to another one. Let's look at the lumbar spine first. Now I got one more cervical picture I can show you right here. Now look at this one. This one actually has some really heavy calcification on the anterior aspect of it. So you guys on the radio, I'm looking at an x-ray that's just basically, it looks like a candle wax that has dripped down the side of a candle, and that candle wax is going all the way around the front, and it's welding each one of those segments shut. They can't move properly. See if I can find that one. There it is. If I move it up a little, there we go. So we got this process going on inside the body that is it's welding these joints shut because it's just causing calcification of that anterior longitudinal ligament, and now we can't move, and we're losing afferent input. Okay, that's another one. So let me show you this last one, because it's the lumbar spine, because I just don't want to show you just the cervical spine. But now if you look at the lumbar spine, now you see here's another segment. So I've got two pictures. I've got a picture of lumbar spine that's healthy, got good disc space. I've got a picture of lumbar spine over here that's not healthy. And there's just good disc space between L4 and L5. There's good disc space between L5 and the sacrum, but L3 and L4 is degenerative with bone spurring, and we got a little bit of decrease there. So what am I saying? I'm saying that this segment right here is now degenerative, and it's not moving. It's degenerative because it wasn't moving, and the chemistry. But I'm not going to get into that tonight, but it does go along with the whole 6:3 ratio stuff. But we have a segment of our spine that is not moving properly. And you ask yourself when you see this, when did this start? Like I had a 7th grader in this week. He's got a little bit of a decrease in his lumbar spine, but his cervical spine's okay. But what do you think we should start with the 7th graders? Would it be a great idea if all the 7th graders in the world got checked for spinal movement? They get checked for when they're kids for scoliosis. They'll check them for scoliosis to see if their spines are crooked, but will they check to see if their spines are moving properly? What about little kids that have cell phones that have their heads in flexion? What do you think their future might be? How long do you think it takes for degeneration to happen in the cervical spine? Now, this is a process. I don't want to use it as a good. It's not a good example of degeneration necessarily. Those other ones that I had open, they're better. But how long do you think degeneration takes? It takes a while. When does it start? It starts at a young age. Why is it so important to make sure that these joints are moving properly? It's massively important. What are we doing to our kids? We're giving them iPads at birth. We're getting their eyes down. We're turning the curve of their neck. What are we doing? We're stopping the input of the brain we're stopping the afferent input that's supposed to be firing into the brain when a curve is proper, and then we're turning off the brain, and then we're getting things that are detrimental to health because of it. And we got to take a break. But when we get back, I've got 5 or 6 or 7 articles open tonight that I just want to share with you, because this all stems from a new patient this week that came to see me with tremors. She wants to know, can I help her with tremors? And she was really confused when she got here, because she was saying, well, I thought you were a neurologist. I was looking for a neurologist. That was cute. By the time she was done, she said, I think I'm going to fall in love with you. Yeah, I'll tell you that when we get back. You guys stick around. This is Life with Jason Clemmons, DC. We'll be right back. You came to the doctor because you had tremors, and you were wanting a neurologist, a second opinion, and you came to the doctor. You came to the Rock Health and Wellness Center because you've got this essential tremor. You can't keep your hand from shaking, and it's like, why can't you keep your hand from shaking? How did that manifest itself? What is the because if you're trying to fix it, you kind of need to know what caused it. Like it's like, why is it that I'm having this vertigo randomly all the time? Like it just comes and goes, but then all of a sudden I'm so dizzy, I can't even function properly. Like it just overwhelms me, right? Could it possibly be a lack of afferent information into the brain? And the answer to that question is yes. But you probably won't get that from a lot of providers, because what you'll get the idea that you've got some crystal in your ear. And you may very well have a crystal in your ear, but I don't think it necessarily is the crystal in the ear thing near as much as it is the lack of afferent information into the brain, which now causes problems. And that's the point of the show tonight, is that, and I want you to see how important that is. When it's not moving properly, it's not only does it cause localized problem in the joint itself, it also causes brain changes. It causes pathologies basically in the brain, and it comes in all forms, in all shapes and sizes. So, hang on, let me get us back on that. Nope, that was a commercial right there. Yeah, this is so confusing. This is so confusing to the general population, because they don't understand degeneration, and they don't understand the abnormal cervical curves and abnormal curve structures, and how those things would affect what's going on in their overall general health. All right, one second. Okay, everybody, we're back. This is Life with Jason Clemmons, DC. We're talking about afferent input into the brain and how it makes changes into the brain. Okay, so it's like, all right, so what? Okay, I get what you're saying. You're saying that my spine needs to move. Yes, that's what I'm saying. I'm saying your spine needs to move. And why does your spine need to move? Not just your spine, your whole body needs to move. You need to keep firing that. You need full range of motion in all of your joints, right? You need to be able to move your joints through full ranges of motion. That's why you say, well, I'm getting stiff. I'm just getting stiff. When you get stiff, you don't move. You don't move, you decrease afferent information. When you do that, your brain doesn't work like it's supposed to. So let's go through some of these and talk about, let's just start with the vagus nerve. And give me a second because I got all these open. We'll get rid of these x-rays for a second. No, this other one, hang on. I got a different one. Effects. Yeah, acute effects, there we go. Acute effects of vertebral manipulation techniques on the autonomic nervous system. This is from Brazilian Journal of Clinical Medicine and Review, July through September 2024, volume 2, number 3, pages 311. So that we're talking about some guys in Brazil. To see what was going. The aim of the study was to assess the immediate effects of an adjustment, high velocity, low amplitude manipulation, on the sympathetic and parasympathetic systems by analyzing heart rate variability in university studies. And we talked about that last night, right? We talked about sympathetic being right hemisphere dominant, parasympathetic being left hemisphere dominant. Overactivity of the right hemisphere keeps us in that sympathetic, fired up, fight or flight state, right? There's your low testosterone, by the way. There it is. If you want to map it, there it is, because it's like if you're in a fight or flight, you're not going to reproduce. That's just the way it works. And if your body's stressed out and your brain is stressed out and it's not moving the way it's supposed to and it's not fed the way it's supposed to, it's going to shut down your reproductive system because it's like, dude, we ain't got time for to be messing around. We got tigers in here. So we're going to do that. So we talked about that last night. So that what they did here is they put 20 students through 2 different groups. One of them received this adjustment and joint cavitations were delivered, meaning you actually had a popping sound, right, to the cervical, thoracic, and lumbar spines. And then the control group, they just positioned them, but they did not cavitate them. Now, what we already know, if we're really thinking about this, they positioned them into an adjustment, but they didn't thrust. So they didn't create that cavitation in the spine. Well, just by positioning them, they created movement. And if they created movement and touch, they're going to create afferent input. So they're going to get a change just by doing that. And they're going to show you in here, right here. So stress refers to the state induced by perceiving stimuli that triggered emotional and hormonal responses in the body. Okay? Emotional and hormonal responses. Because what I'm trying to make the point is, what does lack of this information do to us? All right? It creates emotional and hormonal responses in the body. In acute stress situations, adrenaline, neurotransmitters, and cortisol are released, causing systemic changes and physiological disruptions, keeping the body alert. Fire the amygdala fires the adrenal gland releases the cortisol makes the blood sugar go up, there comes your obesity and your type 2 diabetes. Okay? There's another list of us. What are some of the things that can happen? Adrenaline gets our heart rate up. Here's our blood pressure. There's another issue right there that could be happening from the lack of afferent information in the nervous system. It's just all over the place, right? Heart rate variability assesses the autonomic nervous system. So now heart rate cardiac variability was performed before and after the manipulation. The variables collected were parasympathetic nervous system index and sympathetic nervous system index. So an increase in heart rate is considered a result of greater sympathetic pathway. Heart rate variability is a non-invasive test. So they just put you through there, okay? Key points from this article. The autonomic nervous system is divided into the 2 parts. We talked about that. During acute stress, there's an increase in the secretion of adrenaline and the hormone cortisol, leading to systemic changes. The neuroendocrine axis takes longer to activate and requires more prolonged stress conditions. It Its activation triggers the adrenal medulla. We talked about that, leading to the secretion of catecholamines, adrenaline, noradrenaline, which helps to increase and maintain somatic adrenergic activity, producing effects like those generated by sympathetic activity. I know that's a lot of big words, but chronic and intense exposure to stressors stimulates change in stress-responsive systems, phenomenon closely linked to pathophysiology of numerous diseases. That's what I was trying to get to right there. Cardiovascular disease is one of the leading causes of death worldwide, shows significant changes in response to acute and chronic stress. So down here, this is the key point from this article as far as I'm concerned. Some dysfunctions along the spinal column can cause changes in the autonomic nervous system, leading to a person to exhibit signs not related to any diagnosed pathology. I'm going to read it again, and I'm going to try to read it a little bit clearer this time. Okay? Some dysfunctions along the spinal column can cause changes in the autonomic nervous system, leading a person to exhibit signs not related to any diagnosed pathology. You're getting things that you're showing signs and symptoms of things that you don't have any diagnosis for, and it might be, not saying that it is, I'm saying that it might be a lack of movement in the spinal cord that is disrupting the sympathetic parasympathetic nervous system. All of those pictures I showed you, those x-rays that have reverse cervical curves and degeneration and lockdown and spurring and all that stuff, all those situations are creating interference in the autonomic nervous system, which can be causing symptoms that you don't even realize that you're getting. And that's what I tried to explain this week about the tremor. I tried to explain that about the tremor. Because what is a tremor? If you got a tremor and your hand is shaking, are you causing your hand to shake? In this particular case, I am, but I'm using it as an example. When you're sitting there with a tremor, are you making your hand tremor? I don't know if that's proper English. Are you making your hand tremor? Or are you not able to inhibit your hand from tremoring, moving, right? And it's the second. You've lost inhibition. That's the problem. The tremor is a loss of inhibition. It's not that a person with a tremor is making their hand move. It's that they can't keep their hand from moving, so they've lost their ability to inhibit. Their brain is losing their ability to inhibit. So you can give them drugs, and that's what neurologists do. They'll give you here, take this, and it's like, okay. And some neurologists do a great job. There's a guy I see all the time. I follow him. He's a chiropractor. You guys would love his page if you do any Instagram. Dr. Josh Madsen. Like if you just go to Dr. Josh Madsen, he's a chiropractor in Iowa or someplace. He's just got video after video after video of working on little kids that are not functioning properly. Their brains aren't functioning properly. And he does a fantastic job with that. And what does he do to help solve the problem of the kids? He works on proper afferent input into the brain. He works on stimulating the brain by lasers and vibration plates and movement and walking and balance beams and all kinds of different things that he has in his office. We have a lot of those plates here. What is a laser? A laser is an outside stimulus that's hitting the nervous system. What would a vibe plate? What's vibration? Vibration is increased afferent input. What is making you walk on a balance beam? Increasing afferent input, coordinating the cerebellum that has to do with movement, right? So it's like, why would we do all those things? We would do all those things because what we're trying to do is see if we can reestablish the synapses and the proper nerve pathways that are running through your brain. That's what we're trying to do. It's like, wait a minute, the drugs aren't going to do that. The drugs are not solving the problem. The drugs are just dampening something else or stopping, just like the depressant drugs aren't solving the problem. These aren't solving the problem. They're not solving the problem either. They're just masking the problem. Now, do we always get 100% resolution? No, especially if you're 80 years old and you've got your knees replaced and your hips replaced and your spines and had surgery and your shoulder doesn't work and you hardly can walk and you've got all these problems, right? When you get down the road that far and your body has completely deteriorated, you're going to start to see things like tremors show up. And one of the things that is testable is just looking at a pen, just and just see if your eyes can converge down on the pen. You just take a pen, put it out in front of someone's, a couple feet in front of them, have them look at the tip of the pen, and then just bring the pen right towards their face. And what you see is one eye will come in and the other eye will go the other direction. But then if you cover the eye that's going in, the one that was going the other direction will converge. If it's independent, it'll converge. But if it's not independent, then it's like it'll. I mean, if you use two eyes at the same time, then the brain doesn't have the ability to do that, and it's like, where is that happening? And I pulled up an article about where that's happening, about when a person, I know you can't really see this article, but it's Neural Control of Vergence Movements. It is National Library of Medicine's Neuroscience Second Edition is where I got it from. But it just talks about when a person wants to look at something and how their eyes will move. But when they need to look at something close, they have to bring both eyes together. And that's vergence, or it's convergence, and is what we're looking at right there. And if you go through the chapter and you say, well, okay, where is this happening? Well, it's happening in multiple places of the brain, but one such center is a population of local circuit neurons located in the midbrain near the oculomotor nucleus. So you could take a look at the midbrain, and you say, where exactly is the midbrain? And you're just talking about this brain stem, your pons midbrain area. Here's a picture of it, and this is what I'm talking about. This is the midbrain, and this area that's right up in here. And you got this whole brain stem. That's the lower part of the brain. It's the emotional centers of the brain. It's in the limbic. It's got all that early stuff. It's the freshman class that we talk about a lot. And not the visual cortex is involved in all that sort of thing coming from the eyes, but that center area right there is not working right. And you say, well, okay, so what does that have to do with the way that my eyes are moving? I mean, what does that have to do with my spine and all that? Well, that's the same place that all of this afferent input is having to travel through all that. If you think about where the brain stem is, if you just put your finger right up underneath your earlobe, and you put your finger right up underneath your earlobe and do it on both sides, and then you think, okay, how much information in my body is traveling between my fingers? A lot, right? Not my eyes, not my nose. Okay, fine. My eyelid is actually, it's coming down, coming back up. But you got a lot of information that's going through that part of the brain. And when we lose the movement patterns and we lose the ability to move, what happens is we lose health in that center of the brain. And that area of the brain is also where you get things like vertigo and tremors. So that was the origin of this show, was the conversation that about what are you going to do to help me? Well, I'm just going to try to create afferent input in this mess of a body we got right here. We're going to try to stimulate those pathways, and we're going to see if we can get those pathways to calm down a little bit. We're going to see if we can get those pathways to regenerate and see if they'll fire. That's what we're going to do. And we're going to try every single thing that we know of to do that. Because when you lose it, we can go back to that same article, and there's just things that are happening that you don't even know that are happening. And then you can keep moving down the article, and it's this. Several studies show changes in the activation of the peripheral and central sympathetic nervous systems after spinal manipulation. When you get adjusted, what's happening is you're getting a change in your nervous system. And you don't have to get adjusted. I'll show you why in just a second. It just increases the efficiency of the movement, and it's very important. Analgesia resulting from use of spinal manipulation is generated by descending inhibitory pain services with an indispensable role provided by the lateral column of the periaqueductal gray. Okay, that doesn't matter. Remember when we talked about how you create pain? You start it in the periphery, you send it to the spinal cord, you send it to the brain, and then the brain turns around and tries to bring it back down with descending pathways. It tries to dampen some of that. What this article is saying is that the combination of movements in the spinal column on stress zones in the spine and the displacement of the position of the vertebra can dominate and move various structures of the body in space, alternating normal functions, and you adjust them, and now you can dampen some of that pain. That's just one article right there. Let me move to another one. This is that vagus nerve article that I was talking about just a second ago. All right, vagus nerve can predict and possibly modulate non-communicable chronic diseases. Now that we've gone over this article before, but I just wanted to highlight some of the big things that might happen right there, right? Cardiovascular disease, cancer, and chronic obstructive pulmonary diseases share three important pathophysiological contributing factors: oxidative stress, inflammation, excessive sympathetic nerve activity. Wait a minute. Excessive sympathetic nerve activity. Go back to last night. The last night's show, what is happening? We've got too much right hemisphere activation. We've got too much amygdala, adrenal cortex, HPA axis, right? We've got too much sympathetic activity. What is one of the things we can do to dampen some of that sympathetic activity? One of the things would be to get adjusted. One of the things would be to go for a walk. Increase afferent inputs to get it out of the right brain and get it over to the left, right? And wait a minute, you just that's what I hate about you chiropractors. You think you can cure everything. No, I don't cure anything. I'm just saying that to science. I didn't make this up. This comes from the Journal of Clinical Medicine. October 19th, 2018, volume 7, number 10. These comes from University of something in Belgium, University of Brussels, and Ohio State University. I didn't make this stuff up. I'm just reading it to you, right? And the reason I'm reading it to you is because I'm trying to make the point that because it was hard for the person to understand why they had tremors. And I've got a couple of people that what we're trying to do is work through vertigo. And we're trying to say, wait a minute, I might have some, like, I could feel some vertigo coming on. Well, if I feel some vertigo coming on, and then I go to my medical doctor or my nurse practitioner or my physician's assistant or whatever it is, I might get told that I have a crystal loose in my ear and that's causing my vertigo. And that may be true, but it might not be true because it might be the fact that this lack of afferent information that's into the brain is causing your vertigo. I hope that I don't even know if that makes any sense. I hope it makes sense. So what did they find out from this? Some of this stuff. High vagal nerve activity alters homeostasis. We know that, right? Vagal nerve activity predicts the risk and prognosis of many major problems. We know that. High vagal activity predicts reduced risk of global burden disease and better prognosis in global burden. High vagal activity predicts reduced risk. High vagal activity is measured by greater heart rate variability. There you go. So now that's what the other article said. And what the other article said, that Brazilian article said, we can increase heart rate variability. We can make the heart rate variability better by the adjustment. That's what it said. And so the adjustment has the ability, high vagal activity is measured by greater heart rate variability. Biologically, the vagus nerve inhibits oxidative stress, inflammation, and sympathetic activity. I have patients now coming into my office talking to me about, can they stretch their vagus nerve, or can they stimulate their vagus nerve? Is there something they can do though? Can I buy a vagal nerve stimulator, or is that, what are the things that I could do to floss that nerve? Right? Okay, not saying those things aren't effective. I haven't really studied any of those really. I could tell you that the adjustment and the exercise and the diet all feed back into doing that same exact thing. Let me touch on, because I got a couple more of these. You just so you might want to see them. Here's one with the neck muscles. Influence of neck afferents on sympathetic and respiratory nerve activity. We looked at this too. This is from Brain Research Bulletin. It is well established that the vestibular system influences sympathetic nervous system and the respiratory system. So now you're talking about your lungs. Now you're talking about how you're breathing. It's like, wait, the vestibular system, the sympathetic nervous system, and the respiratory system are all tied in together. Presumably, vestibulosympathetic and vestibulo-respiratory responses participate in maintaining stable blood pressure and blood oxygenation during movement and changes in posture. Many brainstem neurons that generate vestibulospinal reflexes integrate signals from this labyrinth and neck muscles to distinguish between head movements on a stable body and whole body movements. In this present study, responses were recorded from 3 different places of the neck during stimulation of the C2 dorsal root ganglia or C2, C3 nerve branches innervating the dorsal neck muscles. So they're looking at this upper cervical area, and they're seeing, does this upper cervical area affect this vestibular, respiratory, cerebellar pathway? And the answer to that is yes, it does. You can go down I could go through the whole article and it would say yes. Vestibulosympathetic reflexes are well documented. This study and others document cervical afferents to the vestibular nucleus, creating cervical vestibular sympathetic reflexes. That's very important. If you've got forward head posture, you're changing the cervical vestibular system. The vestibular system is that vertigo system that you're getting that's causing some of that vertigo for you. See how it's all like it just stacks and it just keeps stacking and it just keeps stacking. And when you just go after one article after another article after another article, and you can just kind of see how important posture is, spinal movement is, keeping our bodies moving. It's really important. And when your body is not moving properly and your posture is wrong, you will start to see lots of health problems show up, and you'll go searching for the solutions of those health problems, and then you'll end up with a whole bucket full of drugs because they're trying to solve the problem in a way that they're not dealing with the cause of the problem. If they would, and it's if you're younger and you're listening to this show, don't wait till you get old and everything is gone to heck before you start taking care of yourself. And it's like, we could start with kids. I mean, I had a parent today, her little girl was congested and had all kinds of stuff and her eyes were watering and she didn't feel good. And she called me. She said, "Hey, can you get her adjusted?" I said, "Yes, I can." Am I treating her cold? No, I'm stimulating her nervous system, which is stimulating her immune system, which is trying to take care of all that stuff, right? Okay, I know that's a lot of stuff for a weekend show. Maybe you can look at it. If you have any questions about it, send me a text, send me a message. Um, Maybe it'll help you if you're dealing with some of it and you want to know what would they do at the Rock to try to help some of this. That's what we would do. We'd work on afferent information to your brain. We try to get your brain and your body talking to each other. And when your brain and your body are not talking to each other, we call that a subluxation. So you guys have a great weekend, and I'll be back on Monday night, and we'll take health to church.